For me, when I think about a young person who has been raised in child welfare, they likely have not had a stable home. When they're changing those placements, they oftentimes are also changing schools. And those are the things that keep young people grounded and give them a sense of community. When you don't have that, that's a tough road to be traveling for any young person.
Any practitioner in the youth serving field knows that connection between juvenile justice and child welfare. You see the histories and what has led to their juvenile justice system involvement. At the same time, traditionally what we have seen is that juvenile justice and child welfare and education and behavioral health are operating in an individual way, not recognizing that these are the same kids, the same families who are touching these systems. The question for us in developing the crossover youth practice model was, how do we illuminate this population? All with the goal of improving outcomes for kids, for families, and for communities. When the juvenile justice system was created in 1899, it was based on this notion that young people are different than adults. In the 1990s, as a result of increasing crime rates, there was a response to get tough on crime. What we saw was an era in which young people were viewed as quote-unquote super predators. There was a slew of draconian policies and practices that were implemented. Those efforts really were counter to what we know works to achieve public safety and to improve outcomes for kids, which is a developmental approach. In the last few decades, we have seen a move to reverse the trend, reverse those policies and practices. We're not there yet, but the crossover youth practice model is part of that story.
The crossover youth practice model was developed almost at the very beginning of the existence of the center. It was derived from a series of piloting projects that we did in the community. And then realizing that we were having an impact in those pilots, we sat down and said, can we actually construct a practice model that will guide policy and practice, that addresses the characteristics that we know are associated with kids who are involved in multiple systems, and in a way that would interrupt the trajectory that they have headed into those systems.
Inherently, the model is built to be very practice-oriented. And so you have to really dig into the day-to-day practice and understand what the culture is within those organizations and begin to think about how do you change those cultures through changing the way that those who are doing the work think about the work and understand the work and engage in families. And I think that's what the crossover youth practice model does really well.
When we start working with communities, one of the first things that we want to do is understand where they're at. And so the way that we do that is by using a rubric that looks at infrastructure level and at direct systems level to help us understand how this system is functioning. That is coupled with a gap analysis, which looks a little bit more granular at their practices and processes. So not just are you identifying, but what does identification look like? And so those things being done on the front end of our work with the jurisdiction helps us get a clear picture of this is where they are, and this is also where they want to go. Many of the challenges are the same, but every jurisdiction functions differently.
It really is incredible to see how our partners all across the country, in rural communities, in urban communities, in suburban communities, take this consistent guide and roadmap and really make it their own.
It had always been a challenge in our state. Our systems did not operate in the same circles at all. I don't think we had a good understanding of what each other does. And at times we were very often at odds with how we did business. I don't know if Casey agrees with that.
I would agree. And like Amy said, it comes down to relationships. As we sat in those groups, the most conversation we had was understanding the other person's role. So I think that is really a key point to say, this is what I can do, and this is what you can do. How can we work together? So it was really clarifying that and allowing that conversation to happen and allowing that conversation to continue to happen. So I believe that's a huge part of making this process work.
Ultimately, what Nebraska did is they went out and implemented the model throughout the state. And they have a set of protocols that the counties are adhering to relative to that.
It seemed very daunting in the beginning, but then we looked for the in common. What do we have in common? And whatever state you are, what is your common goals and hopes for kids in your state? And move from there. It's easy for me to say now. It takes a long time to flesh out everything, but it really doesn't have to be more complicated than that.
In Florida, foster care is privatized. So one of the most important entities in their work is having the foster care agency having a strong hand in this work because they provide all of the case management services for the young people and families. They had a very strong relationship between Department of Juvenile Justice, the State Child Welfare Agency, DCF, and their foster care agency.
We had noticed that we were getting more kids younger ages with more extreme behaviors. And we knew that, and if we didn't act and try to come together to work with the other entities, that we could end up with these kids flooding the systems. Because of that initial work with these different partners, we were able to divert quite a few children and work to come up with other means of trying to keep these kids in the community, if at all possible.
The work started in Marion County, but it has grown throughout the region. One thing that Florida has done is created positions so that every region within the state has a crossover designee or person who helps to oversee some of that collaborative work within their region. So Florida continues to be a state that has really strong cross-systems work.
In 2016, we started tracking our group home arrest. We found that we had 22 youth who'd been originating from 8 specific group homes within our county.
In the crossover youth populations, a lot of these young people on the child welfare side reside in group homes, which increases their risk for being arrested. But what we know is that a lot of communities still rely on congregate care for a number of different reasons. We support doing training with those providers to make sure that those providers are equipped to best service young people.
We developed a training curriculum with our behavioral health agencies, DCS, and law enforcement, and we had a 69% decrease in the total number of group home arrests and disruptions between 2017 and 2019. For me, that's a big accomplishment that we've had in Pinal County Juvenile Court in regards to CYPM. If we weren't part of this process, we wouldn't have any of these things in place.
When we begin working with the community on the Crossroad Youth Practice Model, we're looking for some indication that they are ready to undertake this kind of work. We also want a community that has come around the table together across systems and is saying, we want to do the work differently. We want to engage each other in a more significant way, and we're willing to roll up our sleeves to do that. Perhaps the most important partner is the judge.
In Allegheny County, we became very concerned with the number of fatalities and homicides that were taking place involving juveniles. We were concerned about the loss of lives with our victims and their families, but we were also concerned about, a number of these juveniles being lost to the adult criminal justice system. We decided to do something about it. So we put together a group, Assistant Chief Probation Officer, a public defender, Director of our Children, Youth, and Families, and then went to Georgetown for the certification program. And when we returned to Allegheny County, we implemented the Crossover Youth Practice Model.
Judges can get people to the table. Judges can keep people at the table, and judges can have a different level of accountability that other stakeholders just don't possess. Those communities that have strong judicial leadership and where this is a priority for the bench tend to do better in the long term versus those communities where they don't have that.
By having the collaboration and having the focus on addressing the child holistically, we're seeing better outcomes. We're seeing less recidivism. We're seeing children engaged in less antisocial behavior. Now our focus becomes the population of the children of color and how they can best be served in order to reduce the disparities that we have always known have existed. We want to do our share of that, not because it's just the correct thing to do or the right thing to do. It's a moral imperative. It's a moral imperative.
As we do our work in the juvenile justice system, we see that it is not a system that provides equal justice in every instance. What we want is a fair and equitable system of justice for every child.
Systemic racism and institutional racism has been part of the system since its inception. We're talking about a system that was developed on the heels of a history in this country where communities of color in particular have suffered greatly.
There's not a community in this country where you don't see disproportionate numbers of people of color being arrested, being incarcerated, being adjudicated, whether it's delinquent or dependent in child welfare or juvenile justice. Those types of things just happen more commonly to people of color. People's perceptions about the behavior of a young person of color versus their white counterpart is treated very differently at all parts of the system.
Whether it's at arrest, whether it's at charging, whether it's at adjudication or disposition, what we see and what we know from the data is that youth of color and other populations experience these disparities. And so it's really incumbent on all of us who work in the youth serving field to identify strategies to mitigate those disparities and ultimately eliminate them.
Racism is embedded in these systems. It just is. The same way it's embedded in the fabric of this nation. And it continues to plague families and communities to this day, and will continue because it's institutional. So it's not just it's shifting with the people, it's built on that. Changing systems is hard, but everybody can change something.
If you want to change your outcomes, you have to begin to see things differently. And that involves how we see the young people and their families, and involves how we see our systems. And it involves examining whether our systems are really working for children and families.
It's really getting system individuals to start listening to those who've been impacted by their system. Because I think over the years we've done a great job of engaging, focus groups, we've done a lot of work and research and trying to get that perspective. But we haven't necessarily partnered with youth and families.
My name is Sonia Brown, and for my job, my official job that I get paid for, I am a family support partner, and I help families navigate different systems for the city of Alexandria. And privately, I am the voice for my grandson. His name is Danny. He gave me permission to use his name, and we use his name because we want you to understand that he's a person. He's not a number. And he's a person that was abused and traumatized as a child. When the judge decided to send him to Bonaire Juvenile Detention Center, I had no idea that at that time she had no idea that he was cross-system involved. And I really didn't realize that as a family member until a couple of years later. So all these things that were not shared could have made a huge difference in his life. For the judge to have a larger picture of the child that stood before her, and then she could have made a better judgment on what she was going to do with this person. The more I'm involved in it, the more I find out just how horrible the consequences actually are, and how easy these kids that are disadvantaged, they're so easy. I mean, you might as well just blow through a straw and blow them right into the adult system.
The thing that comes to mind for me is an insect that gets caught in a spider web. And what you know is that you need to get out and you want to get out, but you have no clue how you go about getting out, because there are so many different directions and different paths, and they seem never ending.
I just really believe that this is going to be the change that Alexandria City needs, so that we can intervene and not have these children funneled into the adult system. And I'm going to use my voice to make sure that people try to make a difference with these kids and start to value their life. You know, they deserve to be valued, and I think if we value them, we'll have a better community.
One of the things that we have learned, which speaks to where we want to go with the work in the future, is that, you know, the practice model, while we do some level of prevention work, is primarily focused on once a young person interacts with that second system of care. And in the evolution of it, we want to go further upstream. We want to look more solidly at what juvenile justice is doing before a young person needs to be referred to child welfare, and the same for child welfare, so that young people are not crossing over at all and we're really ameliorating those risks.
Our crossover definition is a child welfare involved youth that touches the probation system, with the goal of being not to get them formally involved, right? So we wanted to be a little further upstream and proactive in preventing further entrenchment into the system. And so I think we all just came to the realization that we could be doing better.
When I onboarded, CYPM was already underway here. I think the shift has really pushed me to think differently about how we go about meting out justice, essentially.
More of a kind of public health approach to serving families differently and supporting them and addressing their core needs of their family, so that they don't end up either at Marlon's door or my door.
What jurisdictions may or may not understand is by coming together and establishing that foundational relationship with one another, that's really the one thing. And so the rest, is really just the beauty. That's just the byproduct that comes out of, the fact that, you've dispelled myths and you can pick up the phone and you can agree to disagree, but you come back together because you all believe in the relationship and you all believe in this higher goal for kids and families.
I want there to be a point in time where people will look back and say, did we ever do the work really differently?
It takes a lot of work. It takes an intentional focus, but communities across the country have demonstrated that it can be done, and it will continue.